When you are doing a surgical procedure to remove your dog's cancer, one of the things that you'll often hear the vets talk about is clean margins. So what is a clean margin and why is it important? Dr. Dressler.
A clean margin refers to the edge of a submitted specimen. So if I'm a veterinarian and I'm doing a surgery and I remove a growth, and I will submit it to a pathologist. And the pathologist will go around the edge at certain specific locations to see if there are still cancer cells at the edge of the submitted specimen. Why is this important? Well, this is one of the ways that we can tell, or at least get information about, whether or not there are still cancer cells left in the dog. And so when we talk about quote-unquote clean margins, we're saying, okay, the pathologist didn't find any cancer cells on the edge of the submitted specimen, so maybe the cancer cells are out of the dog, or we can say we have dirty margins where the pathologist found cancer cells along the edge, and therefore we can say very likely that there are still cancer cells left at the surgical site around the edges of the incision.
And now, what happens if you don't get clean margins? If the pathology comes back and says you don't have clean margins, what happens then?
Well, I think before we jump to what to do next, I think it's also important to take those margins with respect to the cancer and the location. And if your dog has a benign tumor that's removed, a couple of millimeters could be considered clean. And I think it's really important to make sure you and your veterinarian make sure that those margins are quantified, that they give you an actual measurement, because I've seen all too often where they call the margins clean, but then you read the fine print and they say it's 2 millimeters, and 2 millimeters is not going to be considered really clean or adequate for most malignant cancers. So it's really important that, it's taken in respect with what the cancer is, because I think that's really important and it changes.
So you can't really take as big a chunk out. Otherwise, obviously, you're doing more. You could potentially be doing more damage to the dog.
Well, and it's just important for the tumor type. For malignant cancers, there are some where 1 to 2 centimeter margins is considered the gold standard and adequate. But there are some cancers where you may need, some soft tissue sarcomas where it may be 3-4 centimeter margins. And so if it's just clean and then you find out that it was only a half centimeter margin, it's, puts your dog at risk for recurrence. And if you know that earlier, then you can do something like either a scar revision where they're going to go back and get more tissue if it's in a part of your dog's body where that's an option, or maybe you're going to look towards radiation therapy to prevent recurrence. You might choose to do a wait and watch approach, but at least you know that your dog's at risk for a recurrence. And interestingly, the metronomic approach has also been shown in some cancers to delayed recurrence as well. So that might be something worth talking to your veterinarian about, depending on the tumor type.
Great information. Dr. Ettinger, thank you so much. Dr. Dressler, thank you so much.
Thank you.
Thank you.